Once you have the arm connected to the bed, plugged into the junction box, you can then test the voice access with the patient. This is a unidirectional microphone, so it is listening from one direction only. You do not want to position it where the patient is speaking across the top. It needs to be positioned where we're speaking down into the top of the microphone. All the patient needs to do is read the cell text from any button that they want to select. So for instance, TV controls, we'll select that button. So without any training at all, we'll first attempt to make selections by reading the cell text. TV controls, main menu, channel up, power, nurse call. For some patients, this will work right away, but for many patients, you will need to do a microphone configuration and possibly voice training to improve the accuracy of each button. To do the microphone configuration, you go to Settings, Minimize Window, and bring up the on-screen keyboard. Then select Open Grid, and now select Function and F10. Close your keyboard, select Access, select Voice, select Audio Input. Here you can verify that your microphone is plugged in by looking at the sound meter. Just tap on your microphone and make sure you have a reading on the sound level meter. Hit Cancel. Now hit Configure. Choose Headset Microphone. Next. Position the microphone properly. And then have the patient read the bold printed sentence into the microphone. Peter dictates to his computer. He prefers it to typing and particularly prefers it to pen and paper. The next button will highlight blue once it's ready. Hit Next again. Hit Finish. Hit OK. And then restart the computer. Settings, restart, yes. Once the computer restarts, you can have the patient test those buttons again by speaking them into the microphone. After you've completed the microphone configuration process, have the patient try again to access some of the buttons that they might have been having trouble with. Head down, channel down, head down, head down. You'll notice with several attempts, maybe changing the way the patient speaks the particular text will provide some greater accuracy. But if there's still some cells that just are not responding at all, you can go in and do further training for the patient to get the computer to recognize its voice better. We follow the same steps as before. Settings, minimize window, bring up the keyboard, open grid, function, F10, close keyboard, access, voice, And this time we're going to select Improve Accuracy. Next. Here, the patient will have to read each sentence aloud into the microphone. They need to say the sentence very specifically. This process takes about 10 to 20 minutes, depending on the patient's ability to read each sentence. I am now speaking to my computer. The computer is learning the sound of my voice as I speak. The computer is learning the sound of my voice as I speak. This will help the computer better recognize what I say. Speech recognition can recognize many speakers very accurately, but training the computer will provide an even better experience. One way to make sure the computer hears you, you should practice articulating well. Pause. You'll notice I just paused the training by selecting that button, which I can do by voice, and when I'm ready, I can say resume into the microphone and it will resume training. This will give you a chance to give the patient a break, to sip some water, or rest for a minute. This concludes the tips for speech recognition training session. To read about more tips, look in the help documentation for speech. Now I will select Next, Don't Send, OK, and restart the computer. After the computer reboots, you can have the patient try the same buttons that he was having problems with before. This should improve the accuracy of the patient using voice control.